How does trauma-informed care improve PTSD diagnosis? Imagine walking into a clinic where every step makes you feel safer and more understood. That's the essence of trauma-informed care, which plays a vital role in how we diagnose post-traumatic stress disorder. This approach recognizes that trauma impacts many aspects of a person's life and health. By understanding this, healthcare providers can better identify PTSD accurately and compassionately. One key way trauma-informed care helps is through universal and sensitive screening. Instead of waiting for symptoms to become obvious, clinicians routinely ask about trauma history in a gentle, non-threatening way. This helps uncover past experiences like childhood abuse or other adverse events that are closely linked to PTSD. Patients are given control over how much they share, which reduces stress and builds trust. When people feel safe, they are more likely to open up about their symptoms, leading to a clearer diagnosis. Creating a safe environment is another cornerstone. When patients trust their healthcare providers, they are more willing to discuss difficult memories and feelings. This trust encourages honest disclosure of trauma-related symptoms, which is crucial for accurate diagnosis. Avoiding re-traumatization during assessments means clinicians are careful not to push or trigger distress, helping patients stay engaged and cooperative. Trauma-informed care also involves a comprehensive assessment process. It combines trauma history with ongoing symptom evaluation, making sure PTSD is considered carefully among other mental health conditions. This structured approach helps distinguish PTSD from similar issues like depression or anxiety, especially in people with complex trauma backgrounds. It ensures that no one's experience is overlooked or misinterpreted. Training healthcare staff is essential too. When providers learn to recognize trauma signs and understand their effects, they become better at spotting PTSD symptoms. This awareness reduces the chances of missing or misdiagnosing the condition. Well-trained staff can ask the right questions and interpret responses more accurately, leading to better diagnosis and care. Partnerships with mental health specialists and community resources further strengthen this process. When clinics collaborate with experts, patients benefit from thorough evaluations and access to specialized treatments. This teamwork ensures that PTSD is diagnosed correctly and that patients receive the support they need. Finally, trauma-informed care promotes fairness and equity. By standardizing trauma screening and emphasizing patient-centered approaches, it helps reduce biases related to race, culture, or background. Everyone gets a fair chance for accurate diagnosis, no matter their history or identity. In summary, trauma-informed care improves PTSD diagnosis by systematically and sensitively exploring trauma history, fostering trust, training clinicians to recognize trauma effects, and creating a supportive environment. This holistic approach leads to more precise identification of PTSD, which means patients can get the right treatment sooner. Remember, always consult healthcare professionals for personalized advice and care tailored to individual needs.